And we are sticking with the health topic. We are getting a better understanding of certain cancers that are unfortunately becoming more common, head and neck cancers. It is estimated that more than 72,000 people were diagnosed with the disease. So joining me now to talk to more about that is Dr. Poonia with HCA HealthONE Swedish. Thank you so much for being with us today.
Glad to be here. Thanks for having me.
First, walk us through the symptoms and the warnings that some people might not even know that they have.
Sure. So there's a wide variety of head and neck cancers that I treat, and each of them has its own sort of classic signs and symptoms. But some of the more common things that we see amongst all of those can include neck swelling. Okay, so neck swelling can be a sign of an enlarged or abnormal lymph node. We also see trouble with swallowing, pain with swallowing, often throat pain, mouth pain, ear pain, less frequently trouble with breathing, and sometimes voice changes as well.
You know, when people have those type of symptoms, like my throat hurts or something's going on, it feels funky, but they're like, oh, we're gonna just brush it off. It's probably just that I'm getting sick. Is that kind of like what you get from patients who go to you?
Sure, yeah. So a lot of the time it probably is that patients are just getting sick and have an upper respiratory infection. The problem is when those symptoms last for several weeks and when they start being accompanied by other things like neck swelling, different types of pain, trouble with swallowing. That's when you want to get checked out.
Alcohol and also tobacco, they're also a major risk factor. Why is that?
Correct. So we know that smoking is bad for your health. We know that it causes lung cancer. Well, it also causes a lot of head and neck cancers. The majority of those that we treat in the mouth, in the voice box, alcohol exposure increases your risk as well. And then a lot of the more common cancers that we see at the throat are actually caused by the HPV virus. Historically, they were caused by smoking. We see less and less of smoking-related cancers now, more so HPV-related at the throat.
You were just talking about HPV, you mentioned it. What's the connection there? How do people know that they have that? I know alcohol and tobacco, you talked about that, but HPV, this is a new link that you guys have.
Correct. So HPV is a sexually transmitted infection. It's transmitted by normal practices, and actually over 90% of adults will be infected by it at some point in time. It's an infection that most adults clear, okay, but a very small minority of folks the infection will colonize the back of their throat and unfortunately go on to cause cancer over time.
When people start experiencing these symptoms, when should they be saying to themselves, you know what, let's go to the doctor, now's the time?
Unfortunately, the HPV virus, when you're infected, doesn't cause symptoms. And so that makes it hard to know when you should see a doctor. That said, the cancer will start causing symptoms. And those are the ones that I discussed earlier. The most common thing we see is folks who present with a neck mass. The cancer's already spread to the lymph nodes at that point. Other common symptoms of the HPV-related throat cancer, trouble with swallowing, throat pain, the feeling like something's stuck in the back of their throat.
Is there anything that we can do to lower our risk?
Absolutely. So HPV has a vaccine, and I call it a cancer vaccine because it truly prevents cancer. So only certain strains of HPV will go on to cause cancer in folks. Those strains are the ones that this vaccine protects against. It's very important to get vaccinated early, and so talking to your pediatrician or primary care doctor about receiving that vaccine is very important. Kids can be vaccinated as soon as 9 years old before, ideally, any type of exposure to the virus.
Dr. Poonia, anything else that you would like to add that maybe I missed out?
Not that I can think of, but the vaccine is one of the only things we have that can prevent cancer, and so I encourage folks to get more information about it.
Perfect. Thank you so much for joining us this morning.